Myself, my name is Dr. Raja Adnan Ahmed, and I am a psychiatrist and I work in UK. I've been here since 2005, and I've done all my psychiatry training here. So one of my interests, which I share via social media, is about helping the junior doctors, especially the IMGs, international medical doctors who are looking to move abroad. And I try and find information for them, share for them, and see so they can understand the options. So I'm really thankful for Dr. Rizwan. Dr. Rizwan Qureshi, I've done sessions with him in the past. Dr. Rizwan Qureshi is also from Pakistan, and he has been living in, he's a consultant in emergency medicine working in Australia, and he's been in Australia for over 15 years now. And Dr. Rizwan also got the same interest, and I think that's how we got how we met. That he also helps a lot of international medical graduates understand different pathways. And because he's in Australia, he's come through a pathway when he actually first came to UK and then went back to Australia. So first, I'd like to thank Dr. Rizwan, and you can see Dr. Rizwan is actually not in Australia right now. He's sitting in Pakistan, and he's actually on holiday. And despite being on holiday, he's given me time. He said, let's do it. If you're getting a lot of questions about Australia, let's do it. And I can just thank him from my heart. That this is a great thing he's doing. He's given us time. So, Dr. Rizwan, would you like to introduce yourself and want to say something?
Yes, thank you, Dr. Raja. I think it's a great opportunity always to come on your platform. As soon as I come on your platform, my subscribers list go up, my following improves, and I think I get this notoriety for a few days, and then it dampens down. So I think I was feeling a little bit selfish that it's time to get more notoriety. So how about I join Raja Adnan's session? But jokes apart. Look, in the last, I would say 12 months or so, the amount of questions, as you've said, have just skyrocketed, especially the people who are in two minds, UK versus Australia versus even, I would say, USMLE or other licensing exams. The questions can often be very convoluted and complicated, as we were discussing. And some of the questions are from, if I would say that there are three broad categories of questions, one from the very junior doctors like senior medical student, interns, and first year resident. The second lot seems to be like a registrar who are in some sort of training program or unaccredited training or just working some private work back in the home country. And they really want to make that transition into a more structured training and exam pathway. And the third lot, which I've seen more now, is now established consultants who are working in Pakistan, who are working in other Southeast Asian countries, India in particular, Sri Lanka, and some even from Syria and Egypt. And obviously UK, the biggest chunk. And they're now considering move to other areas. As the world is shrinking, I think the options are improving. So thank you very much. Yes, I've been in Australia for about nearly 18 years now, and I'm working as a consultant in emergency medicine. And we do both share a very common passion of working for IMGs, because we are both in IMGs. And I think it puts me in a very unique perspective, because I've been into the UK system for 3 years, and then I migrated to Australia by sheer, coincidence. And so I've got some sort of understanding about the UK, not as current as I have for Australia, but it gives me a real taste, because the circumstances have not changed. And that real problem is the reason why the people are migrating to Australia.
So thank you, Dr. Rizwan, for sharing insight. I think one of the reasons you mentioned, because since the economical crisis, which has gone all around the world, in UK as well, will be hit with a lot of inflation and increased cost of living. People have been looking about other options. I think same with the low income, middle income countries as well. They want to go out and see if they can earn more. That might be a reason when you're getting more of the senior doctors are trying to ask you that, what is the pathway to move there. So let's start with, I think you mentioned the three very important groups. You said the medical students and the very junior doctors or somebody who's doing internship, they're looking and asking questions. So if we start with them, I think we'll start with, I know every country will have a medical council, like Australia has Australian Medical Council, and they will have some exams or some competencies that you have to achieve to get the license, and that's the license you need to work in Australia as a doctor. So Australian Medical Council exam, I mean, there is an impression, I'll tell you, among the doctors, and they tell this to me a lot. They say, well, Australian Medical Council exam, if you are comparing it to PLAB, the people who have compared it, they say it's actually harder and it is more expensive to do that. So since in the past they've been using this pathway of doing PLAB, which they felt was easier, coming to UK, spending a year and then going to Australia. But more recently, especially since COVID, there has been a problem that the PLAB seats are not so widely available. So people are saying that rather than waiting for 2 years to do PLAB, why don't we just directly look at the Australian exam? It might be harder, but maybe that is the way to go. So if you don't mind explaining your impression of Australian Medical Council exam, how many parts are there, what is the cost, and and because you've been, I know you got your own medical education stuff as well. You do around Australian medical education registration exam.
Okay, so you're right. There seems to be a certain level of confusion, and I think we should avoid some blanket understanding in statements that this exam is very difficult, whether it comes to the license exam, membership exam, or even the fellowship exams, be it in any country. In fact, if you would ask me to grade the severity or penalties or harshness of the exam, I think the fellow of College of Physicians and Surgeons of Pakistan would probably rank the most toughest exam in the world. So, but it doesn't work quite that way. And look, I think the reason I say that is, Dr. Raja, when you consider the number of doctors moving to US and the UK, obviously the resources are humongous. Okay, so these resources, I mean, in terms of online resources, in terms of books available, in terms of guidance. So when you've got that amount of resources and substrate, obviously the exam would not be as challenging. Now, Australia obviously is a small country, 25 million people, the size of Karachi, population-wise. So the resources are not as much out there, even though people are trying to establish more courses, more online resources, and they are now substantial amount of resources. But still, they are lacking as compared to other more established licensing exam like USMLE and PLAB. So number one, this is the most important factor. There's certain lack of resources and guidance. The other thing is that you've got to test the model, that the number of graduates, of fresh graduates who are attending USMLE and PLAB, there I would say they're the top graduates. Like they are switched on in their academia, they're switched on during the clinical training. They're much more engaged in discussion with their mentors and seniors. So they're obviously the top 30%, what I say, of their academic year or their medical school. So obviously their pass percentage compared to USMLE and PLAB exams is going to be higher. Now, Australia is a very unique place in terms of medical practice. The number of candidates who come to our emergency focus AMC clinical courses are actually girls or lady doctors, albeit you can argue the point that mostly there are lady doctors now, but they're particularly girl. 90% of them are housewives who have been married to, the diaspora, Pakistani, Indian, and subcontinent diaspora established in Australia, and they've got substantial career gaps. Okay, so now you can see the part of the equation building up to a very patchy solution. So they are housewife with large career gaps in an environment which is very lacking in terms of resources. So obviously the exams pass rate is not as comparable to the other more established markets like USMLE and the UK. Yeah. So, but I think what I've seen in the last 12 months and 24 months, as I said, there are so many resources which have just completely mushroomed, that the pass rate in terms of AMC1, if you talk about the numbers, about 50 to 60%. And for the AMC2, which is a clinical one, it's also improving. Having said that, Australia is probably one of the fewer countries in which you can just do AMC1 only and apply for a job and get a job. And you do not have to do AMC2 or clinical. You can either go through a work-based assessment pathway, or you can even go through competent authority pathway or specialist recognition pathway and other pathways, which I've made some notes of. And
this is a very significant information you're saying, that you can pass AMC1 and start applying for jobs, and then once you get a job, and then you can sort of find another pathway to get full registration. This is a very significant thing to understand. So this is open for junior doctors as well, do you think?
Absolutely. So the people in my circle of associates through our IMG groups who have been able to bag a job are only AMC1.
Okay, that's great.
And they have been able to get the job from their own home countries, like from subcontinent and anywhere else that they're coming from. And the reason they've been able to get the job is that they've got a very substantial clinical experience in acute medicine, in acute critical care, emergency, ICU, pediatric, NICU, all these kind of experiences with a very minimum career gap. In fact, I would say no career gap. So obviously the authorities over there are, over here in Australia, are quite cognizant of the fact that we should give the jobs to the doctors who are in current workforce. And they don't really mind if that work involves a subcontinent experience, the UK experience, the US experience, the Canadian experience. They try to sort of compare the training standards when you go through the rigorous registration process. So that's in terms of your question about the costing. If you look at that costing structure, that you're only doing AMC Part 1, you don't have to do AMC Part 2 if your career gap is less and you are currently in workforce, and you can then do AMC Part 2 whenever you want to, or go join the WBA pathway, and you're getting paid as a doctor, which is quite a handsome salary.
No, that's a very good, very big advantage. And so how much is the cost for AMC 1 and 2?
So the costs are, I think they've been revised. I don't know the specifics, so don't quote me on that. But I think the AMC 1, there are few pathways. First of all, you have to have your primary source verification credentials. And then there's EPIC verification through each ECFMG pathway. So that process of registration with Australian Medical Council has got a baseline fee, which they can check on amc.org.au website. Then AMC Part 1 exam, I think, is about 2,000 Australian dollars. And AMC Part 2 might be between $2,500 to $3,000. I'm not sure about this exact specific fee, but that's the kind of fee what we're talking about. And so AMC, all in all, if you're talking, sorry, go on.
Sorry, I was going to say AMC 1, you could, because PLAB 1, you can take around the world. You can take in Pakistan, Dubai and all that. For AMC 1, you have to come to Australia to take that.
No, there are other centers as well, I think, or they might not be. I'm not sure really about where the AMC 1 is conducted. But yes, most of the people who do AMC 1 are in Australia.
Okay, sorry, you were saying something.
Yes, so I was saying that in terms of AMC Part 1 and that primary verification process, the whole expense would not be more than $3,000, Australian dollars, that is, which is cheaper than US dollar.
Okay. So after doing, I mean, as you mentioned that you've done AMC, if somebody has passed the exam, do they get registration straight after that, or they have to first apply for a job and then they will get the registration?
So once you've done AMC Part 1, you don't get registration. Or once you've completed the entire AMC process, you do not get registration like in the UK, which is the main point of confusion for most of the UK IMGs who want to come to Australia. They think that by completing the GMC when they're, on general registration, they can come to the Australia. So I'll explain you a bit more in detail. But once you've done AMC Part 1, you have to proactively look for a job. So my advice to most of the IMGs that pass your licensing exam Part 1 is start proactively applying for jobs. And on the other hand, also start preparing for Part 2 of the exam, which still puts you in a better position at so many different levels in terms of your visa and residency issues, in terms of training opportunities, in terms of your placement in Australia as a big country. You have got a better options to work in the city if you've got the AMC Part 2. Like some hospitals are categorically only for AMC Part 2. So people who are more serious about their training, they would like to join the major hospitals, they would, they must try AMC Part 2.
And the other option, I mean, next pathway we'll talk about is the one from UK, because this is something that a lot of people have been talking about and have used in the past, both on the junior level and more senior level as well. I think you used that one yourself and went to Australia. So this is about the rule that if you have done GMC registration via the PLAB route, so I think the first confusion is that GMC registration only via the PLAB route, or you can get registration via other routes, which is like MRCP or MTI and all that. But basically, as far as I understand, if you've done PLAB and if you have spent a year of job in UK, if you've done a year job in UK, then those doctors can start applying for jobs in Australia. And once they secure a job, they submit their documents and whatever they have to submit, and the Australian Medical Council is happy to give them registration, so then they can move from UK to Australia. If you can explain that a little bit, that will be great help.
Yeah. So let's call it pathways to registration in Australia. Obviously, there is no single pathway. There are multiple pathways which have been specifically designed for doctors at various stages of their career. First, we've already talked about the standard pathway, which was AMC1, AMC2, or work-based assessment, leading to a limited or provisional registration. You are a limited registrant if you have only passed AMC Part 1, and you are provisional registrant if you have passed AMC Part 1 and Part 2 as well. And then it leads to what we call general registration, which equates to a full registration of GMC. That's a standard pathway. Then what is more, I think, used, or often the most used pathway, is competent authority pathway, which you are referring to. So competent authority pathway is basically designed for two categories of people. First category are the people who are graduates, medical graduates of UK, US, Canada, New Zealand, and Ireland. So they are the medical graduates of these 5 countries. They have completed their supervised clinical training, so that in the UK equates to Foundation Year 1 and Foundation Year 2. They have done US equivalent of 2 years of residency program on top of completing their medical degree or MD or whatever it is from the US. And they've also completed equivalent amount of clinical experience in Ireland and Canada. They can then apply through competent authority pathway. What is more fundamental is for everyone to understand, and I'm sure, Dr. Raja, you must have had these questions flooded up in your inbox as I do, is there are 2 components of competent authority pathway. And we should be very clear. There is an exam component and there's a training component. The competent authority pathway is a combination of these 2 components, not either or. So once you've done the exam component for especially the medical graduates of these 5 countries, you fulfill that component, and then you fulfill the training component. So that's for primarily the people who are, we call, they're the local graduates or the whites or the local people. They do that. The second number of people who are in large numbers now are IMGs, someone like you and me, who have originally graduated in Pakistan, like me, or India, or some other country, and then moved to the UK, or Ireland, or US even, and now they would like to come to Australia. So what do? Again, there is an exam component. So they would have already completed the exam component through PLAB.
Yeah.
Okay. So they do not have to do the AMC exam. But the important thing is they still have to fulfill the training component for that exam component to be considered. Does it make sense? So basically, if you've done PLAB, and that PLAB is complete PLAB, it's not just 1 PLAB or 2 PLABs, it's complete PLABs. So PLAB 1, PLAB Part 2, and then supervised clinical training in that country, where, like UK, 12 months of supervised training. So that equates to FI2, because most of the people who come to the UK have already completed their house job in their own home country, and they have to do an additional supervised year training to be eligible to come to Australia via the competent authority pathway. The clinical experience component for the USMLE pathway candidates who have done, for instance, there's a person who has done USMLE 1, 2, and 3. They are the minimum requirements, step 1, step 2, step 3. And then they have worked 2 years in residency, because in US, they start from the internship. So the year 1 is pretty much similar to FI1 or house job in Pakistan. So that's why the Australian Medical Council has, set a minimum criteria of 2 years in the US. Same for the Irish. So I get lots of questions that I have done Irish exams and can I come and work? Yes, you can, but then you would have to again do the Irish equivalence exam. Having said that, there has been some confusion around the Irish exams as well, because I think for IMGs, Irish pathway is not accepted. They may still have to do AMC pathway, like a standard pathway. So that is what we call a competent authority pathway.
So
and
what So one of the most important, most common question, I'm sorry I'm cutting you, but one of the most common question I'm getting is that people come to UK in different pathways. The PLAB is one of them one pathway. Some people come via MTI, so they haven't actually done the PLAB. Some have done the other exams like MRCP or MRCS, and then they got registration through there that they come. Sometimes people can directly get sponsorship in UK and they haven't actually done any exams and they still get the registration for GMC. So what about those people? Do you know how do they will this exam component be fulfilled by them or they won't be accepted?
So this is where the area gets a bit gray, and that's what I was looking up this website of AMC. So in Australia, the whole licensing thing is governed by three bodies. It's governed by Australian Medical Council. It's governed by APRA, or Australian Health Practitioners Regulation Agency, and it's governed by the Royal Colleges. Okay, so these are the three, stakeholders who decide whether the doctors can work at what step of the way. For the doctors who have not done PLAB and come to the UK through MRCP route or IMT training route or any other route, as you said, their pathway is not straightforward. First of all, they have to submit their documents to AMC for their primary MBBS verification. Number one step is that. Number two step is that they have to now apply to the colleges. So college, if you go to the APRA website, they have specifically defined the short-term training pathway. And this is precisely the pathway for doctors who want to come to Australia for further training. It's a training pathway. What it means is that they would apply to the college, for example, College of Psychiatry, College of Surgery, College of Emergency Medicine. All the colleges are enlisted there.
Yeah.
And they would say that, look, I have done, say, 2 years in Pakistan in pediatrics. I've done further 1 to 2 years in pediatric ICU and some retrieval services. And my primary MBBS is from Pakistan. Where do I stand in terms of further training? Then college will look into their exams that they've done, all the exams in terms of their own fellowship exam that they've done back in their own country. What training time have they done? What sort of work environment? And they will give them a report that, look, you are at this level of training and we'll take you in that level of training for 2 years. So the short-term training pathway is for 2 years, which can be now extended for another 12 months. So they can be taken in through that pathway. However, I haven't seen the large number of doctors in that pathway coming from the UK as yet. They might now be starting to come, but I've seen many doctors coming from Egypt in that pathway.
Okay.
But I will talk about more that pathway in a specialist recognition pathway, which is a bulk of how most of the overseas qualifying specialists come here to Australia.
Yeah, I think that was the next thing I was going to say. I was just going to say to the participants who are listening to us that if you want to put your questions down, I think we will try and answer them after I've covered this last part. So, Dr. Rizwan, you were going to, I think that's another important part for the doctors who already are specialists in their countries or in UK, or so they contact me a lot saying that what is my option for Australia. So let me give you an example. If somebody who's done FCPS training of psychiatry in Pakistan or FCPS training of medicine, some general medicine, gastroenterology, and then they're saying that I actually haven't got registration for UK, I haven't been to UK, but I want to go to Australia directly. I think that is the competent authority pathway is something that you were going to mention, that if what should be their starting point and what should they be doing, and is there a way for them?
So first of all, Dr. Raja, we have to educate our audience. There seems to be a very common confusion in terms of who is a specialist. Okay. So people often confuse membership exams as being recognized as specialists, which I don't blame them, because in certain countries, they have got that consultant level status based on this exam. In Pakistan, in Middle East, in the UK, you can work as a locum consultant, I believe, or consultant, even I'm not sure, substantive consultant. These exams are not recognized in Australia as a consultant level exams. You will not get into a consultant level position. You will not get an exemption from AMC exam based on MRCEM, MRCP, MRC Psych, MRCP CH, or whatever MRCP it is. These exams, or MRCS even for surgery, these exams are not recognized in terms of in lieu, number one, for licensing exams, number two, in lieu of consultancy exam. They are not at all anywhere. So these exams don't put you in any particular advantage. So people who think that they can come to Australia based on them as a specialist, based on these, because they're working as a specialist, they have to consider the equivalence of their specialization. And the minimum bar, which is set by the Australian or our Australian Health Practitioner Authority, is that you must be a fellow, number one, from the exam point of view. And from the training point of view, you must have been working as a consultant after fellowship for at least 2 years in your home country. So I've had people who have completed FCPS in Pakistan. There's one who joined the radiology program. There's one who joined the orthopedic program. They've had their training and exam recognized partially. So there are two. So basically the process of application as a specialist is a little bit, stepwise. First, you apply for primary source verification that we've talked about. That is MBBS verification via ECFMG and EPIC pathway. Then you apply to the college directly. Say, for instance, if somebody wants to come as an orthopedic surgeon, they apply to the Royal Australasian College of Surgeons, or like Australasian College of Emergency Medicine, or Royal Australasian College of Psychiatry. So they apply to the respective colleges that took, this is my exam. I've done FCPS in Pakistan in orthopedics, and I've done my training in Pakistan, in the UK, and in Middle East. Say, for instance, it's a mixed bag. How much time accreditation would I get in lieu of my training time in these three countries with my fellowship exam? So they will then again look into, have you worked as a consultant in Pakistan? If you worked as a consultant, then what sort of consultant commitments, like what was your job role in terms of academia, teaching, supervision, registrars, college relations? And they will give you either a substantially similar or partially similar. They would be the end recommendation from the college. So the person, most of the people who come from Pakistan are leveled at partially accepted level at a consultant level, which means that they get exemption from the exams, all the AMC exams, all the primary exams of their fellowship, like part 1 fellowship and any intermediary module. And they get, like, you need to do a 12 months or 24 months of supervised clinical experience in orthopedics in these hospitals, combination of rural and regional and urban, and then sit the fellowship exam, and then you'll be accepted as a consultant. So these are the people who have done FCPS, and pretty much all the FCPS are in that ballpark figure. They don't get complete 100% accreditation. They get partial accreditation, but that partiality is somewhat different for everyone, because the people come up with variable experience in Pakistan, as I said, in the UK and Middle East. So they may have 6 months, they may have 12 months, they may have 24 months. It depends on their own experience within different jurisdictions. And then obviously you have to sit the fellowship exam if you're coming from, because FCP is still not recognized an equivalent exam to Australasian fellowship exam. The only other thing which is important to understand, that what type of registration it leads to, it still leads to competent authority pathway registration. So you'll still be provisionally registered. You will not be limited registration, you will still be provisionally registered. And after completion of that program and being on specialist registration, you can apply for a general registration. Whenever that occurs, whether it occurs in 12 months, 24 months, you can apply for general registration, which I said opens up a whole world of opportunities for you. So as a summary, we've talked about, there are sort of 4 main paths. In fact, I would say 5 main pathways. So there's standard pathway, competent pathway we've talked about, the specialist pathway, short-term training pathway. And then there's another pathway which has come into fashion right now, which is called pre-employment interview structured pathway. That's mainly for the GPs who are working in the subcontinent or who have worked in the other countries, but they have not fully qualified as a GP, but they've got at least 3 years of GP experience.
GP experience, I mean, how do they cover the exams? Because in Pakistan, for example, you can work as a GP without doing any particular exams. You may just have MBBS. So when you say GP, are they actually looking for specific family medicine exams in that?
So in Australia, the GP umbrella is governed through number of different pathways. So there is standard, again, what they call is the standard pathway to become a fully, you graduate, you join the program. The program is about 3 years. You do the part one, AKT and OSCE, and then you path and become a GP. So that's the most common pathway for the local graduates. Then the IMGs who come in, they go in through the standard pathway. They get the full registration. They apply for the GP college as a trainee, and then they pass the same level of exams, and then they become a fully qualified GP. The third segment, which I'm talking about, because Australia is a big country, and there are a number of different colleges in that same category. There's a GP college, and there's also rural and remote medicine college. Okay, which sort of governs rural and remote medicine, which is a bit of a hybrid model between GPs and hospitalists in the US, because these GPs have got admitting rights in the hospital. They can admit patients and they can follow them up. So that category is mainly dependent on that FACRM pathway. But the people who are coming from Pakistan, who have not done any membership exam like MRCP GPO or family medicine MCPS, or the Australian pathway of PESCI, which is pre-employment structure interview, they are very clear. We are not going to accept any time. We're not going to accept any training time. We're not going to accept any exams because you've not done any. You're just coming here in an area of need because we're really finding it very difficult to find a doctor to service this GP practice. As long as you've done 3 years of GP practice in the last 10 years, then there's some other sub rules in there that you should have completed these 3 years as 6 months combination in different areas of GP, child, adult, adult medicine, and OB&G and mental health or whatever it is. But basically, this PESCI route is not preferred by a number of candidates because they tend to place the candidates more rural placements because employers need them. They have only got a limited amount of experience back home in the country. And unfortunately, most of the people who are coming in, they're doctoring their own experiences. In Pakistan, there's no regulation, which is very sad to say, because these are the people who really, they think that they've done a very smart move of, fabricating those experience certificate, but they get caught out when it comes to pre-employment interview questions. They're not there. So that's why the Australian health practitioner authorities have said, okay, fine, you may have 3 years of experience, but you must do this. It's almost like an OSCE interview. As long as you don't pass the OSCE interview, you won't be accepted in that training pathway.
So there is another very common question, because I think that is an issue for especially IMGs working in UK. They always ask testing because it's difficult. It's a little bit difficult, almost impossible, not difficult, very difficult for you to get your parents to UK. So if you are working in UK as a doctor, to get your parents, your parents can come and see you for a number of months, but they have to go back. To get them a visa that will make them stay, then get them the British passport, that is very hard. But people have heard that immigration of parents, permanent immigration of parents, is a little bit easier in Australia. Is that true, or is this some sort of a myth?
Look, I'm not an expert in immigration specific, so rather than giving a blanket statement, yes, what I've heard from most people, it is relatively easier to have your parents around in the UK, and I don't know why it's like that. What my understanding is that, first of all, your own pathway to become a permanent resident in Australia is quite straightforward. You, as a doctor, as soon as you get your general registration or full registration, you can use their point-based scoring system to self-evaluate and apply for a permanent residency. And right now, there's a dearth of doctors in Australia. So that whole process is expedited because they want to pull doctors out from India, and all those applications have been stuck. They're really pulling them out. So that whole process of application for initial visa, hospital sponsorship is very seamless. It may be time consuming. People often complain that it's very time consuming, which is right, because there are just so many of them, and their immigration department is not just that level of resources which the UK immigration department is. But the people are still able to get their process straight today. It's getting more straightforward now. So you might be a permanent resident within 24 months of arriving in Australia. And once you're permanent resident, I think it opens up the whole avenue. As I said, you can invite your parents on longer visas. and your Australian residency is another 12 months after that. So it's
It's easier.
relatively, what I've heard, it's easier.
Another common question I get is about the different specialties, because I mean, I know you shared on your page as well this plea from the Royal College of Australia Emergency Medicine saying that we are short of doctors. So people ask, what are the specialties which are particularly short or struggle in Australia, which means that they'll have more opportunities for the junior doctors. So emergency medicine, I think, is your own specialty, so you know about that much better than anybody else. But what about others? Have you heard about them as well, that they are short?
So pretty much all the specialties. But if I was to rank them, then definitely emergency medicine, acute medicine, which is acute general medicine, medical admissions unit, elderly care medicine, and most of the other types of medicine, respiratory medicine, geriatric medicine, endocrinology, all of them have got deficiency in doctor. When I say deficiency, let me reiterate to the same point which I said before. Because Australia is such a big country, the hospitals are on agenda of every government. They want to build more hospital and more health facilities. But when it comes to staffing those facilities, there are no doctors, there's no staff, there's no nursing staff, there's no medical staff, there's no director. So that's why they are deficient. The third area is mental health. It's huge. There's huge amount of funding which has just gone into community mental health, as well as hospital-based mental health practices, because there are hardly any beds available. There's often a prolonged number of prolonged hours of stay in emergency departments for mental health patients, because there are no active community setups to have them a safe disposition and follow-up plan. It's huge. It's the whole incorporation of telemedicine. The mental health is just reshaping into. So if I was to give my personal advice, any acute specialties, pediatrics, emergency medicine, ICU, anesthetics, medicine, any specialty, mental health, psychiatrist, surgery to some extent. It's still, especially if you would like to, work in more regional area to start off with, then even surgery, you can get numbers. But surgery is often very competitive amongst the local graduates who tend to move out more regionally to take up those training positions. So you may have to struggle for one. So you may have had this question, Dr. Raja, that people often ask, what are my chances of becoming a surgeon? So, and I think it's a very subjective question. There is no such question. I think this question is fundamentally wrong. There's no such thing as what are my chances. If I was an intern right now and I would question myself, what are my chances to become a consultant in emergency medicine in Australia today? Then obviously you look at all the pros and cons, and I think there's a very realistic aspect that you might not become a consultant in Australia. So never correlate what are the global chances versus your chances. I think everybody has to put in their own effort, develop their own credentials, which is what we tend to avoid or ignore, and then come up with the whole very pragmatic solution of what my own chances are. The chances are based on your qualifications and credentials. And any specialty is a fair go. Let me say that. Any specialty in Australia. I've had IMGs working as neurosurgeons, IMGs working in cardiothoracics, IMGs working as a radiologist who have done FCPS in Pakistan. So there's no such thing as what are my chances. Please don't ask this question and waste your time. First prove your worth and then ask this question.
Yeah, I think this is, as you said, is a difficult one to answer. People do ask me as well that what are my chances. So I don't know which scale I should put the chances. What should be my answer? Your chances are medium, it's low and high. It's difficult. It's, as you said, it's if you are at that stage of that you are thinking about moving, you need to start taking steps. And if you look at the big picture, it might look very complicated, but you need to find out the initial step and start take those steps. Ultimately you will get there. That's that's what I normally try and explain to the doctors normally when they ask me.
Can I say something on this very point? Because I'm sure that you and I both get a lot of questions. What are my chances? In the year 2001, we were having a career counseling session at Dow Medical College in Karachi, Pakistan, and the ECFMG team were there in our auditorium.
Yeah.
And one of our classmates stood up and said that, what are my chances of getting into a neurosurgical training? And there was a whole panel of Americans sitting there. That was in 2001 or 1999. I'm not sure which year in specific, but the whole panel was sitting there. And they said, what do you mean by chances? You've got as good as of a chance of joining neurosurgical or any other program for that matter. So I think we should really try to learn the aspect that your chances can be excellent if you want that specialty to be your career, even in Pakistan or any other country. Then you have to really, choose this appropriate specialty to get in there. But obviously, they could be pathetic if you're just saying that I'm. People often confuse, and that's the other part, Raja, that people often confuse. Once I've done AMC, the world would be my oyster. Once I've done PLAB, everything would just unlock. AMC, if I would like to give just one message in today's conversation, is please don't confuse licensing exam as your ticket to write to, everything.
Do whatever.
It's
Yeah.
not.
You have to do
It's
a
not.
lot
It's
after
in
that
fact,
as
if
well.
anything, everything apart from that. And that's why doctors get frustrated. So please try to understand that fundamental issue.
I think the other thing people ask you, I'm sure I get a lot of this, is that they especially mention exam and say that how hard is that exam, and it's the same answer you as just it's, if somebody say how hard is AMC or how hard is MRC Psych, I mean I have to really understand what are you comparing it against. It is a doable exam. People are doing it all the time. IMGs are doing it all the time. It's about your time and effort you can put into that, and how much you can talk. You will be able to pass it on. Because a lot of people do. I think should I go for the live questions, which I've got some of them in front of me.
Absolutely.
So I think a lot of these questions have been already answered, because they are specifically asking about different specialties. If somebody asks about the primary care, I think you covered that about the GPs, the chances of GP if they are a British trained GP, their chances of coming to Australia. So you did say that there's a lot of opportunities even in the cities as well, and also in the rural setting.
So I think the important thing to understand there, Dr. Raja, the people who are working as fully qualified and trained GPs in the UK, they've got no problems coming to Australia. They come on contracts. They come on very lucrative contracts, in fact. And that is not for the UK. There's even some understanding with other European countries. So they can just completely walk into a registration. There's not much problem. The people who want to come and join Australian general practice for training, they can come through what we are seeing now, people coming through PESCI route, as I've just said. PESCI route is that if you've got 3 or more years of general practice experience in your home country, you do a PESCI interview. You firstly get a job offer from any of the area of need general practice. Then you do a PESCI interview with regulation authorities, and then you get accepted in that position. And you still have to do AMC 1 for that pathway to be applicable. It's not just like I've got 3 years GC experience and that's it. No, you still have to do AMC 1. Then comes the job offer based on your experience. Then comes the interview, which recognizes you, and then comes the AMC 2 and rest of the bits of the bobs of training, leading to complete fellowship. So GPs are really good. They have got a good future in Australia because there's this huge deficiency of general practitioners.
So I think same for the psychiatrists as well, because the psychiatrists I've spoken to in Australia, they also say that there's a lot of shortage there. So and different subspecialties of psychiatry too. There's a few questions around the non-training jobs in UK, because a lot of IMGs do non-training job when they first come to UK after passing PLAB, and they're saying when you said about having that 12 months of experience in UK, will it count as the non-training post will count on that as well?
Yeah, so that's fine. So as long as so basically what APRA have said that on their website, it should be a supervised clinical experience. It does not categorically say training or non-training. Supervised clinical experience. They would still be, because obviously the GMC is regulating them for those non-training positions. They're still under the same auspices of the regulations, good medical practices, in terms of all that kind of bare minimum requirements to maintain that registration. So as long as there's a proper structure in that hospital, there's a consultant, there's a registrar, there's a JMO, and they're working as a team member, then that's what APRA is interested in. It does not have to be a training position. It has to be a supervised clinical position. And by that supervision, it does not mean that you're a pathway towards a specialization. It's just that you're supervised so that somebody can check on you that you're not doing any huge errors and blunders.
So somebody will also ask about the training and non-training. So in UK, as I was just mentioning, that there is a training path which is quite set, and then there's non-training jobs. So in Australia, do they also have non-training jobs as well? And is this the first starting point for the international graduates?
Yes, so majority of the jobs in Australia are training jobs.
For the
And
junior doctors,
for the IMGs, for the junior, they're all streamlined, as is the case in the UK, as is the case in the US. They join the training position. So every year in May, June, July, August, their recruitment start to begin from the January. January is the intake of the start of the new clinical year. So all of those training programs start January. All right.
Okay.
So majority of the jobs are training jobs, but there are, however, certain standalone 12-month contracts. There's very seldom, there might be 6-month programs in certain states because they're trying to fulfill certain deficiency or some funding has come up to meet up the expected rise in demand or whatever it is. And they might be, so there are non-training positions, and they're not few, they are substantial. And they are primarily given to the people who have got substantial experience within that specialty. Like I've seen lots of non-training position given out to consultant gynecologists from India who have not yet done accreditation process completely, or emergency job in some rural emergency who have not done the exams in Australia. So yes, there are non-training jobs, but they're far and few compared to the training pathway. So any IMG is coming, they could apply for both non-training and training positions.
Another question which is very common, I think they have asked about different specialties, is, in UK, the training is split between core training and the high training. So in medicine, you do IMT for 3 years, and then you go become ST training. In psychiatry, there's 3 years of core training, and then you do high training. And in surgery, you do core surgical training and for 2 years, and then you become a specialist trainee. So what they're asking is that if you've done half here, if you've done only core training here, and then you go into Australia, can they enter through the midpoint and the high training? Have you seen that sort of thing happening?
That's why the APRA has now announced for the short-term training pathway. So that is exactly that. It is training pathway. There is no non-training component in short-term training pathway. So if they go into the APRA website, whatever the college is, they have to apply to the college to have their IMT core training or ST specialist training recognized at that specific point so they can resume their training. In fact, that pathway has specifically been designed for senior registrars and even junior consultants for certain countries. So it's a very good opportunity that people come here for 2 years or 3 years even. And the only thing which comes as a little bit of a disappointment in that pathway, that it does not lead to the consultant or full registration, because they have to still join the Australian pathway. So it's only a training, getting an Australian exposure and all that kind of thing for 3 years. And after that, if they think that they need to, join or give Australian exam, then they have to perhaps restart the conversation with the college that, look, I really like the system. I want to now sit for the fellowship exam in Australia for emergency medicine, let's say. And the college would be able to give them the further advice that now you have to exit the short-term structured training pathway and now have to re-enter into through competent authority pathway. And then you can take the further training and exams. So yeah, it is possible.
The training pathways in Australia, are they also split between like lower training and higher training, like in UK? Or so, like for emergency medicine, do you have like a run-through program, then you start from year 1 and then finish it all, or it's like sort of split between the different? Because this is what people are trying to understand, is if it's split, they want to enter in the midpoint, that, like for example, if psychiatric training is like 5 years, they're asking you, can we do 2-3 years in UK and then start from year 3 there, that kind of thing.
So in Australia for instance, if I want to become an emergency consultant, or somebody wants to become a medical consultant, first of all, you do the internship, obviously. You do the year 1 resident, and then you do a year 2 resident. And then you do a 3rd year as a senior resident. So that's almost what counts as a provisional training period. The first 3 years, year 1 as an intern, year 2 as a resident, year 3 as a senior resident. These 3 years are those provisional training years for medical pathways, for emergency pathway, for ICU pathway, for even general practice and psychiatry pathway. So this is mostly called provisional training years. After that, there's only one way, which is higher or advanced training. So advanced training in emergency medicine, advanced training in surgery, advanced training in medicine, advanced training in the rest of, and that is 4-year, 5-year training pathway. There are no entry points, as far as I understand, while staying in Australia to join that advanced year from midpoint. But you can enter into the advanced training years based on your UK experience for that matter. So yes, that is a possibility to enter into the advanced training if your primary exams are also recognized.
Okay, that's great. I think it's very important. I think some of the questions are around the same sort of theme you mentioned, which you already get. You already said that people are saying they've done, like for example, FCPS in Pakistan or India, they've done MD, and now they've worked in another country in Middle East or in Ireland for a few more years, and then now they are looking for Australia. I think you mentioned that for them, the competent authority pathway is probably the starting point.
So these people need to ask the fundamental question to themselves first. Are they working as a specialist? Well, I shouldn't use the word specialist. Are they working as a consultant in their own home country? Are they fully qualified as a fellow? Like, have they done FCPS? Have they done MD? If yes, number one part, exam part, ticked. Are they now working as a consultant for at least 2 years or more in India, in Pakistan, after the completion of MD or FCPS? Number two pathway ticked. Now the number three pathway is to apply for primary source verification through AMC to have their MBBS recognized, and to college to have their fellowship exams and training recognized. And they will then tell you at what level are you fully, substantially accepted to work as a consultant, which is very rare, mostly reserved for US and UK trainees, or you're partially accepted, which is more common pathway for the Pakistani or Indian and Sri Lankan even people coming to that pathway. So that is one thing that they must understand, to be working as a consultant after attaining fellowship and MD, which is something which they tend to overlook.
Okay. And I think another question about, I think this is more specifically towards the emergency medicine, and somebody saying that they have cleared their MRCAM and have their GMC registration, currently working in UK and a non-training level at S33 level. What sort of move they can make to go to Australia? I think I just putting it to you because you know about emergency medicine more than anybody else.
So there are two pathways for MRCAMs. First of all, as I said, MRCAM has got no recognition in lieu of AMC exams and in lieu of emergency fellowship exams. So it's just not recognized. But the suitable pathways either would be a standard pathway, which would be a long pathway, but then it would be my preferred pathway because it opens up so many different options. You see, Dr. Raja, circumstances don't remain the same. I've had many people who've come here as a specialist category and then they've joined GPs because it's much more lucrative to work as a GP in Australia. It's like operated pretty much on a business model. So by doing the licensing exam, you unlock that potential of that variability. So for someone who's done the MRCAM, they can either enter through that standard pathway, which is AMC 1 at least, and then come into that pathway and then suss out the situation, and then can join the hospital training. The emergency training pathway. The emergency training pathway is a separate recognition step. So they have to apply for the College of Emergency Medicine that, look, I'm ST3 or ST4, you said, this person.
Yeah.
What level training would I be getting entry into? And can I have my exams, which is a primary exam, ignored or taken into consideration because of the fact that I've completed my MRCM? Where does it put me? And then the college, on case-to-case basis, depending on the combination of the training, will say, okay, fine, you've done ST3, ST4, you've got your logbooks, you've got your cases, you are accepted at year 3, equivalent, so complete, fine. In terms of the MRCM exam, I think you do get an exemption from, so there are 3 subjects: anatomy, physiology, pathology, and biochemistry, pharmacology, sorry. So you get an exemption, a partial exemption for certain subject, or you may not get any exemption. MRCAM exam and MRCP exam, unfortunately, are just not good enough in Australia. things may change, but as of this stage now, they don't carry that sort of power.
So you said the membership exams, might not have the same power as what they have in UK. But are they actually recognized for registration? You said they're not they're not recognized for Australian Medical Council registrations.
So
You cannot
membership
get.
exams are membership are not recognized for licensing exams in terms of AMC bypass. They're not recognized for fellowship exam part ones. So they're pretty much useless if you are looking at them from that point of view. But if you're looking that you want to get a job in Australia and you've done some membership exam from the UK, they'll still put your application process a bit higher. That this seems like a too dedicated doctor who wants to specialize in emergency or medicine, and they have got reasonable chance of getting into their preferred training schemes, mainly in the cities, because they obviously carry a better weightage exam. So they still have value, but just not in way of any exams, licensing exams and part one exemptions point of view.
I think there are a lot of questions are about recording the session. I think I was going to say that this will be the recording will be available on this page, and also I will make a copy of this recording and put it on YouTube. And Dr. Rizwan will also have a copy, and he will put it on his YouTube channel as well. And also like to say that you should follow Dr. Rizwan on social media. I'll put some links around when I've finished this session. He's got a very active social media accounts, and he puts regularly different useful stuff which is happening in Australia, and the courses which he has been doing. I think the other stuff you have already been answering there. I think the rest of them are similar questions.
Can I just make my personal recommendation to all the young doctors out there who are, like right now in Pakistan on my annual leave, and had a chance to talk to quite a number of people who are at various stages in their career, but a lot of them are quite young. If I was to prescribe my suggestion for an optimal performance training, I would still advocate for licensing exams. Be it PLAB, be it AMC, be it USMLE. First of all, licensing exams are cheaper relatively compared to fellowship exams. Plus, when you complete our licensing exams, it provides you with a base level of understanding about any sort of assessment process in that country. UKMLE and PLAB for the UK, AMC for other fellowship exams and higher exams in that country. Plus, the unlocked potential, as I was saying, you unlock your potential. Once you've done AMC2 and AMC1, it unlocks your options. You may have an aspiration to become a psychiatrist. You may have an aspiration to become a vascular surgeon or a radiologist or an anesthetist for that matter. But, the life is different. You may not have the same priorities 2 years, 3 years down the line. And if you change your priorities, then it's very difficult if you haven't got licensing exams. And I speak from an experience of some of my very close friends who were in a bit of a pickle, actually, because they came through a very dedicated pathway. They had not done AMC pathway or any licensing exams back in the day when there was a huge deficiency. They just came in by doing English exams. Can you believe that? It was possible to come to Australia and get limited registration just by doing English exams. Anyway, so they came in and AMC part one. And then they could not pass the fellowship exams. After completing 7 and 8 years of training, they could not pass the fellowship exam. And as you know, most of the colleges have now got a time cap limit in terms of number of attempts and number of years you've spent. So they pretty much wasted all their training time, which is very sad and unfortunate, really. And now some of them went into GP, one just working as locum doctors, which is a hard reality. But had they done the licensing exam at very beginning, it would have opened up the option very early in their career that, okay, fine. And I think for most specialties, the fallback mechanism is always a general practitioner pathway, because you can still maintain your own particular sub-interest in that. Like I have got adult, like mental health interest in that. I've got like pediatric interest. I've got a gynecologic interest. I got more wounds and wounded interest and all. So general practice is still a good fallback mechanism. So by doing the fellowship, by doing the licensing exam, AMC 1 and you unlock that potential a lot early for you. Options are always available to you, rather than when you've exhausted everything. And some of you might be on visas, then there would not be any extension in visa, and that's really sad. So by doing the full full licensing exam, you get permanent residency within 24 months. Great. You can pull over your parents for that matter. You've got free healthcare and free education for your kids. You've got potential to join any training program. Like people have come from surgical program into emergency. From emergency, they've gone to ICU. It's like changing the trains and platform almost. So that's something which I would still advocate for. It is that do the licensing exam, plan them well, and there's a way to it. And I think that the successful people that you see, they are multimodal in their approach. And I think, Dr. Raja, you're one of the very fine examples. You're still trying to pursue higher degrees, which are absolutely god. I don't know. You've just completed a PhD in medical education.
No, master's, not PhD. Sorry,
masters. Yeah, okay. Masters. PhD might be the next step.
No, I think you are very. Some of the points you touched are very important. I think you, as you said, different doctors will be at different stages, and they'll try and take different pathways. But for junior doctors, I say to them, if you have already made up your mind that you are going to train abroad, I think I think you will be in a stronger position if you start from as a junior doctor. And as you, for all the reasons that you said, as you mentioned, because I started, and when I came to UK, I started as a foundation doctor, and you can say that I have to redo my house job when I came to UK, because foundation years are actually house job. But that gave me the foundation. Then that gave me the confidence, which was required for me to then build upon. So if you are starting in the middle, you're right, absolutely right. You might find that you don't have certain elements which may be required in the future. So that is very, very good advice, that if you are actually going for a country, start to look for their licensing exam first. See if that's something you can pass. Absolutely. If somebody coming to UK from a sponsorship pathway who's never worked in UK, they might struggle. But somebody who's coming from PLAB, they would have actually done those OSCEs, which covers the most common clinical problems. They would know how to deal with them. They will know the basics of talking to the patient, talking to the staff, and how that is done.
Man, it's all the same. Once you've built the foundation, as you said, it's just finer tweaks to much more expert level. And the other question which I get asked a lot really is, in fact, you might be a better person to sort of reflect on that, is people want to still go to the UK because obviously more training positions, there's much more established diaspora in the UK of international medical graduates, there's much more resources and exams which are universally accepted. So they want to still say that, look, dates are not available. I would still like to go to the UK, take the PLAB, and then come via the competent authority pathway to Australia. Because obviously the situation in terms of longevity, professional longevity is not there. So what is your advice on that? I think, again, it's a very blanket question. And my advice to all such people who may have actually put on some questions in your question panel is dedicate yourself initially to one system only. Don't confuse yourselves that I have to move to Australia. Yes, you can. I did, in fact, yes. But when I was moving to the UK, I had never, even thought about Australia. And circumstances change. Maybe, they get full accreditation. MRCP, MRCS, American exams would be fully recognized. Who knows? The way the world is moving, there's such a dearth of doctors, and trained doctors, that is, that things could change. They've already expedited the permanent residency process for doctors by tenfolds. So don't be in two minds that if I don't make it, then I've got a fallback mechanism, and start inquiring for that now. Because I cannot practically give you a right advice. If you are wanting to go to the UK and then come to Australia right now for things that are not going to happen for another 2 or 3 years. So there's no point wasting your time and my time for that kind of questions. Dedicate yourself to the licensing exam in the UK or whatever route you want to choose for the UK. And once, you're exhausted that avenue, sucked it dry, then come to Australia. For me, I was not getting into a training position, which was my priority. Maybe your priority might be different. I had completed my MRC SED, and I was not getting into training position. I said, why should I waste my time? Why should I have a career gap when I've had none? So I'll go to Australia first with the mind of first 12 months. And they were here, they were doing a roadmap show, and I moved to Australia. And it was the right decision at that time. So similarly, their experience may dictate somewhat of a similar situation after the completion of exhausting all, they may have achieved their exams and all that, and they may unlock some more potential whilst being in the UK. And circumstances might change. And it's one thing which we've not talked about, and it's beyond the scope of this conversation as well, is finances. And it's not relevant at all for at least the first 5 or 6 years, or at least I would say till you become a consultant. Once you become a consultant, yes, by all means, put every figure into your prospective earning. But before you become a consultant, you should really skim down training to unlock more avenues for you in terms of a better consultant position, better options to work in multiple countries, maintain active, specialty licenses across jurisdictions, which is amazing. So right now, someone like you or me, we can practice in Australia, in the UK, in Pakistan, in Middle East, as fully qualified psychiatrists and emergency physicians. It did not stem from the thought that I'll go to the UK and then come to Australia and then work in Middle East. Well, nature obviously had different plans. That's how it has eventuated now. But dedication rewards. Your dedication to one system resolved because you are able to focus on that thing.
I think absolutely right. That's I think we should. This is a very important point you mentioned at the end of this session. But I must say that a lot of doctors, as you said, will ask me, and they're trying to compare. And I don't blame them. I know they come from low income countries, low to middle income countries. So they will be saying, how much will I get paid in UK? And then they'll immediately try to count that and say that. So it will be in rupees. And I'll say you actually won't be spending in rupees. You'll be earning here and spending it here. Then they'll compare it to what Australians are getting, what Americans are getting. So I say to them, that nobody actually asks me what will I be learning. And my advice is always to the junior doctors: is try and focus. I know it is hard to be a junior doctor. I know there's a lot of conflicting issues going on in your life as well, family issues and all of that. And then you are trying to do exams, and work-life balance is an issue. Long hours is an issue. But your focus should be on getting better and better at your skills. So once you have those skills, once you have those stamps with you, and once you are able to do those jobs, then the world will open to you, as you exactly as you mentioned. The world will actually open doors for you and say, come and work here. But because they know then by that time that you can actually do that job, you have actually learned all of those things. Very, very, very common example. People will send me a lot of screenshots saying, I've got 3 job offers. This salary is that, this is here, this is there. Which one I should choose? I will always say, speak to the people working there and ask them which is the more supportive department where you learn the most. That's the most important. A few £1,000 here and there is not an issue, because you need to find a more supportive environment to work in. So I think that is similar in the lines we were saying. But I like to thank you for actually doing this session. I think you've done it while you were in Pakistan on holiday. That is a very amazing thing. A lot of the questions which I've just seen are actually the things which Dr. Rizwan has already answered. So you can watch the recording of this session, which will be on this page, and also I'll put it on the YouTube as well. Do you want to say anything else at the end, Dr. Rizwan?
No, I think you've summarized as well. As I said, that there, in just a quick summary, there are multiple routes of getting registration and then license to practice in Australia. There's a standard pathway, which is AMC 1, AMC 2, or WBA. The unique thing about the standard pathway, which is unique to Australia, is that just after AMC 1, you can apply for jobs and get a job, and then do the AMC 2 clinical or WPA pathway in your own time after you start earning. So that's very unique, and one should exploit that if they have got no career gaps. When I say career gaps, anything more than 3 months counts as a career gaps, no matter what the APRA put on their website or AMC put on the website. Anything more than 3 months is not acceptable. So that's why my proactive advice to all the IMGs is, if you've got any gap more than 3 months in the last 12 months, go back to your home countries and do a job. Do a supernumerary job, which equates to patient assessment management, and that is standard pathway, and you'll get the job immediately. And we've seen plenty of examples based on that. The other thing is competent authority pathway, and that is basically for people who have done PLAB as an exam component, and as a training component, they have actually done 12 months of supervised clinical practice. That is not in, a training post. It's a supervised clinical practice. It could be a non-training position as well. And they can, once they've done that 12 months of supervised clinical work in the UK, they can come to Australia through competent authority pathway, through which they get a provisional registration. No more AMCs. The other thing is what Dr. Raja was asking. Lots of people are in the midst of their training, core training, joining on to ST training or ST training or core training. They can come through what we've called now a short-term training pathway. And that can, based on your initial licenses arrangement of that primary country, could be limited registration or provisional registration. And then you can spend 12 months, 24 months, or even 36 months in Australia to get more experience. It is always for a training pathway. You actually apply for training position based on your experiences in the UK and join the training program here in Australia in the middle. And then the college will tell you where you can, at what specific point you can join in based on your experiences. And final, that pathway we've talked about, final two pathways is specialist recognition. That is the hospital pathway. Is if you've got fellowship, not membership. Please don't ask this question to Dr. Adnan and me. Membership in Australia, unfortunately, as of 2023, January 15th, is still not recognized. But if you've got a fellowship, if you've got 2 years of consultant level experience in your home country or any other country, then you can apply directly to the AMC for primary source certification, specialist college for your training and exam qualification, and then you'll be either recognized fully or partially based on your individual circumstances. Yes, and I would say that, look, right now the world is changing globally very rapidly, and there are new avenues to explore. If you want to dedicate yourself, dedicate to one system only. If you want to come to Australia, great, come here for the next. I think this year and next is going to be still very favorable, and you can join any training program. Don't ask this question, what are my chances? Your chances are as good as any of, yes, obviously you'll be struggling more. You'll be putting more hours in terms of that preparation. That's for any other specialty in any other country. Neurosurgery in the US is not easy. Neurosurgery in the UK, for that matter, is not easy. Or orthopedics or dermatology, any other specialty is not straightforward for even the local graduates. So don't ask that question without asking your credentials. Are my credentials worthy of me landing into that training position in the UK, Australia, or US for that matter? But if you are committed, Australia is one of the best countries, I would say. Better than UK, it's better than US. In fact, in training area, you get paid more than any other countries. Expenses are obviously more, but still tax-wise and expensive-wise, not as that bad. But that's a separate discussion. But thank you, Dr. Adnan, for giving me this opportunity. And on a Sunday, I hope you have a good day. And I'll share the video from my page as well, and through my YouTube channel once Dr. Adnan shares the video, and we'll take it from there.
Okay, thank you very much, Dr. Rizwan.
Thank you.
So